Hi, welcome to today's episode on Fast Intelligent Care. We will talk about something that a lot of clinicians will come across, which is clients sleeping in their recliner chair. So we want to look at, is it safe? Is it something that's smart? And how can we manage this growing trend in a way that is both clinically sound, but also respectful of our clients' needs and wishes? So let's dive right in. So firstly, we'll go through some of the common reasons why your client might prefer to sleep in their recliner chair. What are some of the benefits of sleeping in a recliner chair? What are some of the risks that we can't ignore? And is there a better way forward? So looking at how do we address this if it is something that we don't want the client to be doing? And what can we as clinicians and carers do to make sure that our clients are getting the best treatment in terms of an alternative, or how can we make sure that if they are sleeping in their recliner chair, that it is still good for their posture and pressure distribution, and in general good for their clinical needs. So you might assume that sleeping in a chair is just about convenience, but when you ask your clients why they choose a recliner chair over their bed, there could be quite varied responses, and some of them very valid reasons. So some would say they feel trapped in their bed, so they want to be able to interact with family members, they want to be able to watch TV, be in their living room with others, be able to have increased function or independence, and might feel like if they are not in their recliner chair, they then have to be in bed, and then they might feel more isolated, or they might feel like they have to wait for someone to come and help them transfer out of bed. It could also be that they find that it's easier for their caregivers because their caregivers don't have to transfer them as often, and then it's less manual handling and strain for family members or carers. And we could also have the cases where clients feel like they can't breathe properly when they do lie completely flat, like on a standard bed. Or it could be restrictions in the home, so they can't get upstairs if the bedroom is upstairs, so they can't get to their bed, so it's too difficult. So best is to just stay at the lower level of the house and stay in the recliner chair. And some say that the recliner chair is just something that they enjoy sleeping in because it's comfortable, and they just can't actually fall asleep in their bed. So comfort could be a big reason for that. So what do these reasons have in common? Comfort, function, and independence. So let's go through some of the benefits of a client sleeping in their recliner chair. Because let's face it, and let's be fair, there can be some valid benefits from sleeping in a recliner chair, such as having your posture being better supported, especially with your tilt and space functionality. It could be clients with COPD or motor neuron disease that want to stay semi-upright, which helps improve their breathing and coughing. And we could also have the cases where it's easier for the client to transfer from their recliner chair. It also gives the user a sense of autonomy, especially if getting into bed requires help. An example case study of this is a 45-year-old man with MND or motor neuron disease who could only clear his airway by semi-standing and leaning forward, which is a position he couldn't manage when he was in bed. So the right chair, used the right way, can meet short-term care goals, but long-term might not be as beneficial. So let's go through a few risks that you can't ignore and have to be aware of when your client is sleeping in their recliner chair. So sleeping in a recliner chair can cause serious health issues, even if convenient is not ideal for their function. Someone sitting in a recliner chair with gravity, we can have fluid pull in the legs. So all the fluid is going down to the legs, where if you're lying in bed, your legs will be more elevated or more in line with the heart. So you're getting that fluid going back to the heart. Then we have pressure injury risk. So simply sitting in a chair places pressure in high risk zones like your coccyx or tailbone, elbows, and your heels. Because if you're sitting in a recliner chair, you also do have your arms on your armrests. And then the most common concern would be tissue deformation and cell death from prolonged pressure, from shear, And once that sets in, recovery is going to be hard and slow. And we do know that once you get past your stage 2 pressure injuries, those pressure injuries heal very slowly, and we know that pressure injuries can be fatal. And we can't reverse a pressure injury once it gets past that stage 2. So that person will always then be at a high risk of pressure injuries because that skin will be permanently damaged. If someone has to sleep in a recliner chair, what are some of our best practices to make sure that we are avoiding those risks? So one of the first things that we can talk about is our tilt and space feature. We also want to introduce scheduled repositioning even when they're in the chair. So this means we're shifting our weight. So it's either leaning forward, shifting side to side. So taking off pressure from different areas of the body so that we can get that reperfusion, which is blood flow coming back to those tissues and not occluding the blood vessels for too long, so that we are getting cell damage and cell death. When we occlude the blood vessels, we are preventing blood from getting to the tissues. So we're preventing oxygen and nutrients from getting to those tissues, and that is going to cause what we call tissue hypoxia and cell death. So now that we've looked at introducing scheduled repositioning, we also want to consider our seating surface, so our cushion. So if we have someone that's sleeping in the chair, which means they're going to end up spending quite a lot of time in the chair without getting out of it, we do want to think of using something like alternating air. And this is where we can get cells that are going to inflate and deflate in a cycle. And this is something that is going to have a pump, which in this case it is important that the pump isn't loud, because we do want the person to have good sleep quality. We don't want the sleep to be disrupted by the sound of the pump. So the World Health Organization requires 50 decibels or less for the client or for a person to have uninterrupted sleep. So make sure that when you do look at a pump, it is below the 50. Then we want to make sure that we're monitoring the client for incontinence, nutrition, and hydration. These are all important for preventing pressure injuries for our pressure care management. So if we have someone that is spending a lot of time in their chair, we want to make sure that if they do have incontinence, if they do have an accident, we're making sure that it is being cleaned properly. They're not sitting in the urine, especially urine being corrosive. We want to make sure that we keep the skin dry, but also hydrated enough, not too dry, but we don't want wet skin because that's going to increase breakdown of the skin. So if someone is sleeping in a recliner chair, we want to make sure that we are looking at if they are going to be vulnerable to pressure injuries on their back, because typically the pressure care properties are mostly within the seat, and your backrest might just have a filling. In cases where someone does sleep in their recliner chair, you might need to check that the backrest has an overlay that might give more pressure care, or we might need to look at changing the filling that is going into those cushions of the backrest. We don't want to forget the heels. When someone is sleeping in a recliner chair, the heels are also a very vulnerable area, a high risk zone. So if someone's sleeping in the recliner chair, it is very important that their leg rest is the right length. We don't want the heels to be on the leg rest. They need to be completely offloaded, or you need to use your heel offloading devices, so heel offloading boots, but preference would be for the person to have the heels offloaded. Now, we don't want the feet to go too far over the leg rest that the feet drop, because then you're going to get that plantar flexed or forward flexed foot posture, which we can, if someone's really sleeping in it in that position, very easily develop contractions, and that is going to then reduce range of motion in the heels. That's going to possibly affect weight bearing. That's going to affect how they're sitting in the wheelchair potentially. So we want to make sure that if they are sleeping in the recliner chair, we're making sure that the heel doesn't have pressure. So what is something that we as clinicians or carers can do for these clients? So if you're supporting someone who is sleeping in a recliner chair, start with why. Is it because of comfort? Is it because of breathing? Is it a fear of feeling trapped in their bed? Then we can walk backwards. It might be a case where the client feels like the chair has better pressure care properties than the bed. then the solution shouldn't be to sleep in the recliner chair, but rather to look at what is happening with our mattress. How can we rather get the person back into bed? We can also look at bed features that make it easier to transfer out of the bed, such as bed levers, overhead self-help pulls, so a pull that you can pull yourself up or pull yourself forward if you have caregivers that need to place a sling behind your back, or even having a bed pole that you can use to get yourself sitting over the edge of the bed, and using a height adjustable bed to do your sit to stand, and making sure that your mattress is stable if you're still doing transfers, that you're not using an air mattress that doesn't have a firm sidewall to assist with transfers. So look at why are transfers difficult for the client out of bed. Should we consider a hoist, a standing hoist, a sit to stand aid like your Seracettis, your Oxford Up type of transfer aids? Those could potentially lighten the strain on caregivers and make it easier to get in and out of bed and in and out of your recliner chair. But it's not always about equipment. It is about a creative clinical thinking. There might be other reasons why the client is preferring their chair. So a lot of it is doing that investigation, making sure you really find out what is the reason that they prefer the chair to their bed. So let's wrap up. Is sleeping in a recliner good or bad? The answer is it depends. Short term, for specific conditions, it could be fine, but long term, we do need to consider the risks. We do need to consider if there is a better alternative, if we can improve someone's sleeping system instead of them sleeping in their recliner chair. What are some of the risks that we can't ignore and that we need to be mindful of? And then, what is a better way forward? What are some features that we do need to have in our chair if we are having a client sleep in it, to make sure that they aren't experiencing those risks? And then what are some equipment features or equipment that we can use to make our sleeping system more successful for the client? Thank you for joining today's episode. If you have any experience with your clients sleeping in recliner chairs, if you've come across any creative solutions or equipment that helps with clients sleeping in their recliner chairs, we'd love to know your thoughts in the comments. See you in the next episode.